All right, let me go ahead with the introduction. Again, my name is Anton Avancenia. I'll be moderating the session. I am from the University of Michigan and have been supporting this wonderful conference for the past 4 years now. You are in track 4 with the theme Integration and Redesign, and we are expected to hear 3 wonderful presentations today on varying topics, but related to the theme. And we'll just go through them in order. Some of them have submitted pre-recorded presentations, and I will play those for you, but the speakers and the presenters will be available for question and answer at the end of the session. Each presenter will have about 17 minutes to go through their content. And then at the end, we'll have about 5 minutes for question and answer. If you do have any concerns or issues with this track, with this meeting, please do not hesitate to send me a message through the chat box. All right, with that, I'm gonna stop sharing my screen and hand it over to our first presenter, Caroline Healey.
Good afternoon, everybody. My name is Caroline Healey, and I'm the project manager for the Global Fund Malawi Supply Chain Integration Project, which is managed by Chemonics International. As an introduction, I'm going to be talking you through our integration project in Malawi, which was set up by Global Fund in August 2019. The Malawi Supply Chain Integration Project is focused on integrating the current and existing parallel supply chains that are currently operating in Malawi and managed by the Ministry of Health, supported by Global Fund, USAID, DFID, UNICEF and other partners. And the objective is to move away from parallel supply chains and to create one nationally owned and managed supply chain system able to provide critical treatment and support at all levels of the supply chain and to all facilities, right down to the last mile. And I think this is particularly important during the time of the COVID pandemic. And the project wasn't designed with this in mind, but it has become more pertinent. And I think originally the project was designed with ARVs and malaria drugs in mind, but actually our whole objective has been to bring together and maximize partnerships between the Ministry of Health and other government departments and implementing partners. And it's important to say that this includes the private sector and third-party logistics providers who are currently responsible for storage and distribution of HIV, TB, malaria, and family planning commodities in Malawi. So as I say, this project wasn't designed with COVID in mind, but it has actually been able to respond to COVID in some ways. Our focus partner for supply chain integration is the Central Medical Stores Trust, or CMST. This is the government agency responsible for procurement, storage, and distribution of quality and affordable medicines in Malawi. However, it does not currently have responsibility for the management of all donor-funded commodities, including ARVs, malaria drugs, and other drugs. Over the years, CMST has faced a number of significant challenges, and these include lack of accountability, poor procurement practices, stockouts, expiries, poor data visibility and availability, and I'm sure many of those who are tuning in now will be familiar with these issues. This has largely been a result of lack of standardization of work practices, poor management controls and processes, and a general lack of coordination and lack of effective joined up data from all sources. In addition, the many parallel supply chains managed by the different implementing partners have added to the general sense of lack of coordination and collaboration in Malawi. And this has led to costly and inefficient distribution systems that are often duplicative. And I think it's only fair to say that there has been a lack of trust in CMST to manage drug supply chains effectively and in an efficient and transparent manner. However, in recent years, the Ministry of Health, CMST, and stakeholders have been making a concerted effort together to work to improve systems and service delivery. So as a result, since 2017, CMST has been able to demonstrate significant performance improvement. And this has really helped to restore confidence in central medical stores. As a result of this, the Ministry of Health, together with all its partners, including CMST, have developed a roadmap for full integration of the parallel supply chains into one nationally led system. This is focused on building CMST capacity to manage the integrated supply chain and as a result, meet the treatment needs of the people of Malawi. So the aim of the supply chain integration project is to strengthen CMST operating systems, key performance indicators, and improve systems and visibility, and to create one specialized institution supported by all the partners and able to manage all commodities in Malawi. So the approach of the supply chain integration project has been to create a people-centric, data-driven approach with 3 pillars. And these are transparency and accountability, performance management, and change management. The aim is to empower Central Medical Stores, CMST, to manage Malawi's health commodities and the supply chain and to build trust in CMST services by building the transparency and accountability and data availability. And the aim is that this will be measured by robust performance management and KPIs. As an overall approach, the Ministry of Health, Central Medical Stores and its partners and stakeholders have identified the key technical pillars of integration, and this is addressed as part of the supply chain integration process. You will notice from this table, which is extensive but doesn't include all the activities, you will notice that no one element is taken in isolation. The belief is that a holistic thematic approach across all the supply chain areas will generate the best results. So as a project, we are looking at organizational development, IT systems, warehousing, procurement, distribution, but we also look at leadership, financial management, communications, and brand management. And then as a further pillar for us, we've been looking at the business processes with CMST, how it is financed as an organization, and also its governance structure. And I think in future, we'll be looking at whether looking at autonomy is the way to go for CMST or other methods of governance. So how is this project supported? The Global Fund is currently managing and supporting the project overall. And as part of this process, it has embedded a project management team within the Central Medical Stores buildings. A team of experts, including a project manager, and I'm the project manager, and thematics, these are thematic specialists covering supply chain management, information systems, financial management systems, and organizational strengthening. And we all operate out of the Central Medical Stores Trust. And we work with CMST management and leaders to implement the project. And each of us works with a counterpart. So I work very closely with the CEO, and our aim is to work together to strengthen operating systems and to ensure the achievement of project deliverables. So we're not a team that operates outside the building. Even during the pandemic, we have stayed within the organization. So as a project management team, we've been based at CMST since August 2019. And this slide shows just some of the activities that we've been involved in. The project is based on an annual work plan, an implementation plan, and that was developed by the Ministry of Health, Central Medical Stores, our stakeholders, including donors and implementation partners, and ourselves, and it includes private sector representatives. This is very much a partnership project, and this is key. And our projects are based on achievable deliverables and KPIs in a short space of time. As you can see, these projects have involved strategic planning, development of SOPs, redesign of warehousing and storage layout. We are currently involved in the procurement of a warehouse management system, IT equipment, racking and reach trucks. And we are also working very closely with our other partners, and we're working at a national level on developing a master product code register and providing support to national GS1 activities. And we are again working with CMST to develop their corporate strategy and business plan. And we are also undertaking a full financial needs assessment. A key objective of the project is to improve customer service so that CMST can improve its revenue generation and also ensure that CMST has its best people, equipment and inventory systems and services available. Our approach is very much based on change management, and we see this as key. The objective is to lead from within, and working with the Chief Executive Officer and his directors, we've agreed objectives and priorities, and these evolve throughout the project life cycle and involved all CMST at all levels. And again, we use data to develop and build internal accountability and stakeholder trust. The aim is to make this data available externally to the ministry and our partners so that they can see the progress being made and the lessons being learned. So how is all this being managed? As I said earlier, this project has been developed very much in partnership with the ministry and implementing partners, and also ourselves as the project management team. But to manage the process, a high-level integration steering committee was established in August 2019, and this includes all the relevant stakeholders, and they are tasked with providing project guidance and oversight. The project management team reports on a monthly and a quarterly basis to our stakeholders. This has included regular visits and check-ins with the Global Fund. We hold technical meetings on a weekly and monthly basis, and we meet other ministry departments and stakeholders and work with CMST staff internally to ensure they are kept fully appraised of programme developments. And during the pandemic, although many of the project team have been working off-site, we have used Zoom, Skype, WhatsApp to provide weekly updates, to hold regular meetings, and we have kept the project and its deliverables going throughout this period. So the supply chain integration governance structure looks like this slide. At the top is the high level, the National Supply Chain Integration Committee. You then have a technical groups membership, and their mandate is shown here, and programmatic task forces that deal with specific thematic areas such as warehousing or distribution, procurement, etc. Actually, this approach has worked very effectively throughout the lifetime of the project. It may look complicated, but actually it works well. In putting together the overall project work plan and the partnership structure, all stakeholders made a number of key assumptions for the success of supply chain integration. This includes the establishment of the operational engaged steering committee, but it also includes buy-in at ministry and Central Medical Stores Trust leadership levels. And I'm pleased to say that we've had that throughout, and also support from the donor community. A focus has been on ensuring that CMST has the resources to support the implementation of the project. And we've been working with CMST, Global Fund, and the Ministry of Health to ensure that CMST has access to grant funding to support the procurement of systems and equipment. And we are continuing to work with CMST to ensure that it gets additional funding at government level and maybe elsewhere. So the next stage of the integration progress, and to build on the success so far, is to develop a master supply chain transformation plan. This is the next stage. This is a 5-year roadmap which addresses all national supply chain requirements. This goes beyond the current supply chain objectives to include human resource development, waste management, and a national approach to health management. Again, the master transformation plan includes M&E's action plans timelines and SOPs. And it will create a further base for supply chain funding from 2021 to 2025. And again, it's very much a partnership of MOH, the Ministry of Health, Global Fund, USAID, DFID, UNICEF, UNDP, and other stakeholders. The schematic shows the key areas in terms of supply chain transformation plan, but also in terms of looking at the enabling environment. And again, Master Supply Chain Transformation Plan will include support for health facilities, including electrification, water supply, and communications. So in conclusion, going forward, the Supply Chain Integration Project and the Master Supply Chain Transformation Plan will work hand in hand to build capacity at all levels of the supply chain. The Master Supply Chain is incorporated into Malawi's Global Fund grant for 2021 to 25 and is a key document. And it will inform and guide other donor-funded initiatives. So thank you very much, everybody. I'm available to take questions, and thank you for listening.
Thank you so much, Caroline. And you were on the mark in terms of time. So thank you for that. We are now taking a few questions before we go to the next presenter. So if anyone has a question, you may raise your hand in Zoom or unmute yourself and ask your question yourself. You may also type it in the chat box and I can read it off for our presenter. While we're waiting for questions from the audience here, you mentioned, Caroline, that you had started this work months before the pandemic hit. I'm wondering how much of your activities have shifted because of the challenges that the pandemic has presented for Malawi.
Actually, it's a really good question. And actually, I was listening to what Clinton was saying at the beginning of the sessions this morning. It has affected things, but in a way, we've had to be more focused. Some of the team remained in Malawi. Some of the team had to go back to their own bases. But actually, I think it's meant that we've had to focus. So between Central Medical Stores Trust and ourselves, we've put in a program of weekly meetings, including Global Fund, and we've actually focused on procurement of a warehouse management system, racking and other equipment. So the program has kept going in a different way. So we haven't had the one-to-one contact, which we do miss. I won't lie about that. But it has meant that our actions have had to be very targeted with regular just conversations and feedback and reporting.
Wonderful. Thank you for that.
Hi, Caroline. It's Ishmael.
Hello.
Hi. So is there a timeline for completing the integration?
Well, I think when we started, it was interesting. I think the initial thinking was that it was going to be done in 3 years, and then that reduced down to 18 months. And then actually we've kept that date somewhat vague. So I think what will happen actually is that supply chain integration will segue into the master supply plan. But I think now the thinking is that the integration will happen within the 5 years. I think it's worth saying is that the private sector, as you know, in Malawi is very important. So the intention is not to drive them out or anything like that. I think we will be looking at creative ways of working with third-party logistic providers and central medical stores. So, again, there will be a continuing role for everybody.
Caroline, we have maybe the final question for you here. In the chat box, what change management methodology did you use on the project?
We did at the beginning of the project, we worked actually with the people that deliver initiative on the skills assessment and a training needs analysis for CMST. And actually that brought in other government departments as well within the ministry. And actually that was really helpful. And that's the sort of the system that we followed.
Fantastic. And then there was a follow-up to that question. How do you deal with resistance to integration and change, given that framework that you use?
Actually, that's a really good question, actually. There has been resistance. I think the organization is well known. I would say it has been a long journey, a positive journey. I think I would also say it's about the stakeholders working together in partnership and everyone having a common objective. And I think a leadership, even within CMST, that recognizes that change has to happen.
Fantastic. Thank you so much, Caroline. Please stick around in case we have time at the end for additional questions on your presentation.
I certainly will do. Thank you.
Thank you. But now we will transition to the second presentation, which is actually a pre-recorded video, which I will share shortly. By Chad Davenport, who's actually also signed in, and we'll take questions later on. So let me now play this.
Hi, my name is Chad Davenport, and I am the Chief Information Officer for the Partnership for Supply Chain Management. Today, I will share our perspective on supply chain resilience within the context of the challenges and successes we have had this year. In particular, I will highlight where we believe that resilience has come from and how it actually played out in reality, along with how those challenges in the end help drive lasting change. First, who we are as PFSCM. We are a global procurement services agent that coordinates and oversees procurement and delivery of health commodities, working with donors, suppliers, and recipient countries. We procure and deliver a wide range of product categories to support both treatment and prevention programs for HIV, malaria, and TB, as well as broader public health programs. Most recently, we have helped 71 countries access COVID diagnostics and laboratory supplies as part of a coordinated international response to COVID-19. Over more than 15 years, PFSCM has delivered almost $7 billion worth of health commodities to 101 countries. And our parent company, JSI, has supported health and development programs for more than 40 years. With our depth and breadth of experience, we have seen a lot of what can go wrong and what can go right within public health supply chains. As everyone in the audience knows, today's public health supply chains face many challenges. Change is near constant, and our clients and the patients that we ultimately serve are demanding more flexibility and agility in almost everything we do. In the face of those demands, resilience, the ability to spring back in the face of disruptions, is critical. And over the next 10 minutes or so, I will make the case that it must be built and it must be based on deep experience. If you haven't done the hard work to build the necessary structures before you face that next disruption, you can't go out and buy resilience when you need it. It's just too late. So many of these disruptions will look familiar. Like most of you, since the spring, we have faced COVID-19 related disruptions up and down our supply chain. On the logistics side, we saw transportation restrictions, including port closures, locally and internationally. We faced massive flight cancellations, particularly in the passenger airline space. Because the products we ship increasingly require air transport due to short shelf life, and cold chain or frozen transport, particularly for diagnostics, the drop in available flight options hit us hard. Suppliers were also directly affected by COVID-19. Manufacturing sites had to be closed down or run at much lower capacity due to labor shortages and lockdown. So of course, quite a few suppliers struggled to fulfill orders due to stalled production, decreased resources to process orders and importation documentation, and other issues. In some cases, we saw unprecedented inflation in both product and service costs. And while there has been some recovery, the end result was many delayed and partially fulfilled orders, and some suppliers continue to struggle. These disruptions also led to knock-on effects in the market. Responding to new demands for COVID diagnostics, some suppliers shifted their production capacity from HIV and malaria test kits to COVID diagnostic production, A rapid surge in demand for PPE brought quality-related issues, and some suppliers and service providers dropped credit terms in favor of upfront payments. All of these necessitated a response. To address disruptions in the logistics market, our team coordinated with donors and suppliers to shift transportation modes from air to ocean freight where feasible. We expanded our use of certain 3PLs and added new service providers to create more options. We worked hand in glove with our existing providers to problem solve, and we increased our use of charter flights. On the procurement front, we had to kick into high gear to identify new quality assured sources of products to absorb the new and changing demands, along with production capacity issues. And for some products, there was a proliferation of new suppliers, which gave us an opportunity to diversify and expand our supplier base across product categories. But just making those changes alone isn't resilience, it's reacting. Resilience comes from having done the hard work of being ready. In our case, we started building our foundation several years ago as part of our digital transformation strategy. You all will likely have seen something like this graphic before. Like lots of organizations, our supply chain strategy started with technology. But it's critical to recognize that technology is just a catalyst, an enabler. Technology alone solves very little. Instead, it is your people that drive change. Those people operate within your organization's process framework, and they execute tasks within your systems that reflect your processes and governance framework. So in practical terms, transformation is not an academic exercise. It's about getting the day-to-day fundamentals right, doing the hard work it takes to manage change for your people, simplifying and streamlining your business processes, and putting structures in place to ensure your organization is flexible enough to harness new best practice insights that your teams gain through daily execution. And your solution must reflect the fact that we are all of us, acting within a highly interconnected system in which each stakeholder plays a role. None of us is alone. As such, our solution allows us to connect with our partners in a network which enables streamlined and effective collaboration. Our network is running smoothly, and it's grounded in processes that have been streamlined and relationships that have been built and battle tested. Everything we do is underpinned by our ISO certified quality management system. Our connected network has been central to enabling us to absorb shocks. If we were scrambling to figure out how to collaborate with our partners, streamline data exchanges, and handle emerging issues in the face of recent disruptions, things would have ground to a halt. More concretely, within PFSCM, we've spent the last couple of years expanding our pool of trusted freight service providers, both globally and locally. Each is integrated into our network. We've expanded and strengthened our supplier base. We have onboarded some key suppliers into our network to enable direct digital collaboration on order execution. And with all of our suppliers, we've invested resources in building stronger relationships. With these structures in place, when times of crisis hit earlier this year, resilience began to emerge where we needed it. Because the changes we implemented were not enough by themselves, our supply chain network needed to flex to absorb the impact of disruptions. We and all of our partners needed to be fast, to be digital, to be integrated and collaborate within our networks where possible, to leverage battle-tested processes to bring new clients and new commodities and new freight service providers on board, to leverage governance structures to manage the capture of accurate master data on products, logistics details, sites, and funding sources into our system. And not just any data, but the right data, because mistakes cost time that we didn't have. We needed to leverage our relationships to lean on suppliers to absorb increased demands, collaborate with freight service providers to come up with new options, and even to coordinate with other procurement service agents to pool resources. And in most cases, this resilience didn't emerge because of a discrete, targeted fix. Instead, it arose at the intersection of the various pillars of our people, process, systems, partnerships, and governance structures. So, some examples of what this resilience looks like in practice. Within our COVID response, one of the key needs was to quickly set up new clients, new suppliers and their new items, and new freight service providers, along with all of the requisite master data. Here, our master data and transactional integrations with external systems and associated validations were critical. Our governance structures helped us manage the daunting challenge related to ensuring product quality assurance standards were met. These were coupled with daily communication with the client. Together, these solutions allowed us to flag and access the requisite data to set up new clients and suppliers before receiving initial requests. It was also critical to ensure tight collaboration and open lines of communication between our team, our clients, and many suppliers. Through these channels, we provided advance notice where possible of upcoming orders, managed changes as transactions were executed, and worked together to troubleshoot problems, including managing volatile demand and continuing production challenges. And the performance results were pretty compelling. We've handled over 200 requests totaling $60 million and counting, over 300 orders. Our requisition turnaround has been a median of 1 day, and our order turnaround has been a median of 0 days, otherwise known as the same day. On-time in-full delivery of 99.4%. And we were able to accelerate many shipments to deliver earlier than we initially thought possible based on production lead times. On average, we achieved overall lead times of less than 8 weeks from initial client request to delivery, and the fastest transaction was executed in 9 days. In the case of cold chain, managing these shipments is a perennial challenge. Passenger flights are used heavily with restrictions on the amount of dry ice that can be shipped and priority given to passenger baggage. Infrastructure on the ground can be limited, and certain destinations have major constraints related to aircraft size. So in our experience, promises about capability often fall short. So add on top of this COVID-related disruptions of passenger flights, and we were virtually grounded, at least early on. Efforts to shift passenger flights to cargo stalled in the spring. And then on top of everything, the end of March, we received a large urgent order for reagents used in laboratory diagnostics and HIV viral load testing, products that are shipped frozen using dry ice. Only specialized air service providers were equipped to move the cargo, but demand for charter services was through the roof. So to handle this, we leveraged our streamlined onboarding process, our expanded base of freight forwarders, including some cold chain and frozen specialists, data on freight rates, and relationships with key government officials and stakeholders to book a charter for about 75 tons of cargo at below market rates. We were also able to offer the remaining cargo space to a peer who had the same pressing need to move life-saving health commodities to Lilongwe. And here are some of the action shots of what that collaboration looked like. The co-loading was completed in a matter of hours before the charter flight was due to leave for Malawi. When we started working together, the arrangements for PFSEM's part of the cargo were already pretty advanced. Even though the additional cargo was picked up late, with all hands on deck, we loaded the plane just in time. Once all the products were loaded, the shipments comprised a mix of fragile frozen reagents at a temperature of negative 20 degrees centigrade, cold chain products kept at between 2 and 8 degrees centigrade, and ambient consumable products. So after many years in this field, this was the first time we've been able to successfully co-load a charter. Both parties were able to deliver on service commitments at reduced cost and carbon emissions. Pretty compelling stuff. So taking a step back, we've learned during this crisis. The hard work we did to build our digital supply chain paid off. Our solutions have now been further tested. And while we continue to face challenges, we have been able to absorb the largest shocks we have faced in years. Now is the time to build on those new lessons that we have learned. We're already reviewing internally which solutions have been most effective and incorporating those into our longer term strategies for improving and expanding the services we offer to our clients. That includes things like expanding on existing automation, an area where we built capabilities but deployed them slowly given the level of fluidity in some of our clients' requirements. But targeted automation coupled with expanded integration has been very effective, and we're expanding where we use it. We are also expanding our supplier base further to ensure that we have diverse options across an array of suppliers that can deliver quality assured product and performance. And we're fully onboarding more suppliers within our network to drive increased digital collaboration. We continue to add new freight service providers, testing them to ensure that they can meet our service delivery requirements. And we are expanding options for the use of smart sensor technology, again, piloting providers to ensure that the reality of their service matches their promises. And we are working with country stakeholders to solidify processes that were simplified during the recent crisis to allow product to move more quickly. All of these improvements are much easier with the foundation we have under us now. We believe this is what real resilience looks like. As a closing thought, I'll share an observation from a recent McKinsey article where they said, the crisis is likely far from over, and the sector's innovation capabilities must continue to rise to the challenges presented by both COVID-19 and the economic fallout from its spread. In our view, and in our experience, you have to have your stable foundation in place and already be working on optimizing your digital execution. That strong foundation will enable us to absorb future shocks and amplify the impact of sustainable supply chain solutions, like building a network of local and regional pre-qualified wholesalers on the continent of Africa, and expanding the capacity of local and regional freight service providers. And it also amplifies the impact of disruptive innovations in supply chains. Real investments in AI, IoT, GS1 capabilities are either made or underway in many countries. But the impact of those solutions is much greater when connected to an optimized supply chain network supported by proven people, processes, and execution expertise. Many thanks for your time. I will be happy to take any questions you may have during the Q&A period.
Thank you, Chad, who is, again, in this call, ready to take some questions from the audience. Well, people are probably typing that out in the chat service. Chad, that was a great statement there about resilience, something that you can't buy when you need it, but something that has to be built. And it's really about readiness and agility. And you said it's not always about technology, but always about people. I was wondering if you could speak to the changes in kind of personnel and human resource demands that you've seen when the COVID pandemic hit, and you and your team at PFSCM made those incredible fast-paced changes to respond to the crisis.
Yeah, so I think echoing what Carolyn said earlier, I think crises tend to focus people's attention. So we, within our organization, took a really hard look at some of our internal collaboration structures, but also how we were collaborating with the Global Fund as a key client, key suppliers, key countries, and stood up structures to reinforce the way we were working with each other to the point where we were effectively engaging on a daily basis. So in the COVID response in particular, because in many cases, it was all hands on deck. There were emergency orders coming in. We gave that example of the 9-day order. We had about a day lead time to create the country and all the financial flows in our system before the order was coming in, and we were expected to turn it around in 2 hours, and we were able to do that because of those collaboration structures. So I think it was building on relationships that were already there, but also, frankly, addressing some weaknesses in relationships where they existed that we had let languish for longer than they did. So yeah, I think these crises will really shine a light on where you have weaknesses in your supply chain, and also allow you to quickly triangulate where things are working well and where you have a chance to build and strengthen. And I don't know, Ishmael Muchemenyi is also on the call. He's our 4PL Services Director for PFSCM, and he's also willing to answer any questions on these things.
Ishmael, yeah, please feel free to jump in if you have anything to add, but we do have a question here in the chat. What was the biggest challenge you faced within the warehouse with regard to stock management?
So we're not actually doing as much warehouse stock management at the moment. And so much of our challenges were really around supplier relationships, particularly in the COVID response. In many cases, suppliers were bringing on new products onto line, and often their commitments, even in contractual agreements with the client, they weren't always able to meet those things. So a lot of what we were doing was working with the suppliers to ensure that they could make stock available to meet the requests from clients. And if they weren't able to make all of the stock originally committed, working with them and the customers to draw down stock that was available and then ensure that the remainder of what was requested was fulfilled as quickly as possible. So it was a little bit more collaborating with the vendor on their managed inventory than it was working in the warehouse solutions. In some of our other engagements, we do operate warehousing solutions to support countries in their own implementations of central medical stores. But if Ish wants to jump in, he has a little bit more context on that.
Thanks, Chad. So from what we've seen, that there's not been any strategic stockpiles available, largely for a lot of the emergency requirements, particularly COVID test kits and others. So if anything, the market is really battling to meet the need. So half the time we've got to rearrange, the logistics because suppliers are not able to fulfill, the orders, at the same time. So I think that's a consistent challenge that we're having to face.
Thank you. And I want to thank Danielle for translating the question in French, but we have here a question that goes, my opinion is that leadership is built with all PSM players. We are at the level of the public in Ivory Coast. Can you share with us your experiences in terms of coordination of the supply chain? Not sure if you can add more to this. So I'll post the other question too. In your experience of what are the greatest gaps or challenges that countries have in terms of data management and information systems?
So I'll try to take both of those really quickly. I think the first question was around coordination with up and down the supply chain with all stakeholders. I think one of the things that we found early in the COVID response, but also just in managing our other execution responsibilities in the face of supply chain disruptions, was where we had weaknesses in coordinating with some of our key country level stakeholders. And because of the nature of these supply chains where donors are often providing funding, but the countries themselves often, they own the supply chains, those were critical for us to address as quickly as possible. So we actually, in some of our client services teams, we reorganized with a country focus to ensure that that was top of mind on a daily basis around keeping lines of communication open, around transaction movement. And so that was definitely central to our response and critical to enabling us to kind of bounce back from some of the early shocks. As far as data management, I think one of the key challenges is around clear and shared governance to manage alignment and synchronization of master data. So we mentioned briefly some of the integrations that we've established with the Global Fund system that allow us to mine their master data on effectively a real-time basis. So we know when there are changes to their master data, and we can match those things up against the data in our system to know if an address has changed, if a site has changed, if a new grant has been created for an existing client. And that allows us in our systems to react ahead of the curve to make updates that we need in our system to then be able to absorb when the transaction with that new grant, that new site, that new location comes in, and we're not reacting and scrambling to try to do things behind the curve. So the data management, data governance, and shared structures to keep those things aligned with one another have been really important for us. It allows us to operate a digital supply chain as opposed to an email and PDF supply chain.
We have two more questions, and I'll pick one as a closing for you, Chad, and the other maybe you can type your response in the chat for the person who asked the question. But this question goes, what is your approach to decision-making in the supply chain information system?
So I'm going to have to interpret what the questioner is asking a little bit there. I think for us, a huge part of our strategy over the last couple of years has been to move to data-driven decision-making. So to ensure in particular that everything that we're doing is driven through our systems to get our users, to get our processing out of the old way of doing things where communications and authorizations and executions were captured in email, and then somebody would retrospectively enter those into the system to reflect the date something that happened. So in order to really drive operational decision-making into the digital space, we tried to flip that whole paradigm on its head and structure our processes and train our users to think network first, system first, capture the information, and then if you need to communicate something externally through email with somebody else, go ahead and do that. And that makes it much easier for us to use the tools in our system for proactive management and to allow analytics for both short-term market analysis, performance trend, alerts before we're actually doing retrospective analysis. It just makes the entire decision-making process data-driven as opposed to the way we used to operate. And that's been critical to us. I don't know if that answers the question that was asked.
No, I thought that was a great interpretation of the question. And to the person who asked this question, feel free to clarify what you meant. I'm sure Chad can respond to you in the chat service or at the end of the session if we have more time. Thank you again. I get to you and Ishmael, if you could stay behind too, just in case we have some time at the end to accommodate more questions to you and the other presenters, that would be great. Yeah. So for those
Absolutely. Thanks for your time.
Of course. And if you joined in late, we're at the last presentation for this track. It's also a pre-recorded video, which I will play shortly. Yep. Of course, the presenters are also here, including Wendy Prosser, who should be able to answer some questions at the end. So.
Hello, and welcome to the session, Redesigning Immunization Supply Chains, Results from 3-Country Analysis. My name is Wendy Prosser. I work for JSI, specifically supporting immunization supply chains. I've put together this presentation together with Olamide Folorunso from UNICEF Supply Chain Strengthening Center. And what I wanted to talk about today, to provide a system design overview, what it is, how we are using those terms, provide an overview of the countries where we've done this work in Madagascar, Guinea, and Niger, both from the supply chain summary and the country demographics. We want to dig into the details of the scenarios in each of the countries, look at a high-level review of the results of the analysis that we did, and then really the lessons learned that we can take away to help shape global thought leadership on supply chains and system design. So system design, as you know, is an evidence-based approach to analyze and modify the supply chain components. So this is looking at all the different components of the supply chain, from product selection to procurement processes to policies and strategies for inventory, for distribution, warehouse location, and looking at the components, seeing how they work together and what can be changed in order to improve availability and access to essential products and services. And as we've all seen, often the system's design itself is the barrier to performance improvement. So this process is built on 4 pillars to help try to improve the performance of the supply chain. The first pillar is that it is evidence-based, and we use both qualitative and quantitative data to analyze the different scenarios. It also must be stakeholder-driven, involving national and sub-national level stakeholders to inform analysis and to ensure collaboration across all partners. It is context dependent, so it cannot be a cookie cutter copy and paste approach. It's very dependent on the country itself, on priorities of the country and individual subnational context as well. And it's also program oriented, and supply chain cannot be looked at in a siloed context. It must complement program decisions as well. And some common system design alternative scenarios are common across supply chains in the world. New product introduction is one scenario that people will look at. I think this is very relevant right now with COVID and the COVID vaccine being developed. Inventory holding points is another question around the system design of people looking at different optimizing storage capacities and points and delivery frequencies. The distribution network on the flow and any type of level jumping or different tiers of the supply chain. And the transport operations, delivery frequency, direct delivery, transport routes themselves, and of course, stock levels and how you can optimize stock levels at different supply chain points. And all of these different alternative scenarios are being driven by supply chain innovation, such as drones that are now delivering health products, the different vial size presentation that could actually improve different performance factors. And that is what's driving system design and innovations. So we did analysis in 3 countries, Madagascar, Guinea, and Niger. High-level overview is that these countries geographically and demographically are very different. Madagascar is very large. Guinea is much smaller, about half the population size. A couple commonalities, however, is all 3 countries are less than their ideal target range for DTP coverage of 80%, and also with their effective vaccine management scores of those assessments, also much less than that ideal target of an 80% performance. Then the supply chains, you'll see Madagascar and Niger both have 4 tiers to it. Guinea's system has 3 tiers to their supply chain, which just reflects the sizes of the countries. So the scenarios, what we did to start this process is have an introduction workshop in each of these countries to help stakeholders understand what system design is, what it can and cannot do. Stakeholders also identified issues, barriers, challenges to the immunization supply chain, and prioritized areas that they wanted to address through the system design approach. And they identified different scenarios that we could model out in order to identify options for the supply chain design. Here's some common scenarios across these 3 countries. I won't go into the details, but generally 3 countries were interested in changing the delivery frequency. 3 countries were also interested in looking at the supply chain levels. One wanted to add additional regional levels to be more in line with the administrative structure. Others looked at different, fewer tiers and fewer levels of the supply chain. 2 countries were interested in network distribution, really kind of ignoring administrative boundaries for optimal distribution routes. 2 countries were also interested in drones and using drones for vaccine delivery. 2 countries were interested in integration either vaccines into central medical stores supply chains or other cold chain products like oxytocin into the vaccine supply chain. And finally, 2 countries were also interested in direct delivery to the lowest levels, instead of having health workers go and fetch vaccines to be able to deliver them directly to the facilities themselves. So one thing I think was really interesting that came out of this is you have stakeholders identified both qualitative and quantitative indicators. So the qualitative is the new twist to this, right? The quantitative indicators such as total supply chain cost and the cost per dose delivered, the capacity of cold chain utilization, those are normal metrics that we use for supply chain measurement of performance. The qualitative indicators that stakeholders agreed on is risk of mishandling products, such as how many tiers in the system, how many times a health worker has to touch vaccines before they get to the last mile, and if that increases or decreases the risk to the vaccine themselves. The logistics burden on healthcare workers was a significant interest of stakeholders because health workers in all these places from the facility level have to go to the district to fetch vaccines, which means they are leaving their health facility for a day to go fetch vaccines, and often they have to pay for it out of pocket. So it makes a very unreliable system. And then the feasibility to implement redesign is really linked to political will and the effort that it would take to actually implement some of these changes. So we use these indicators to compare the different scenarios to weigh out the best and the pros and cons of each one. And so with the results, I will not go through all the details and the nitty-gritty details of the results, but I did want to provide just a high-level overview of how the results were analyzed and compared across the different scenarios and between the countries using these 6 criteria. So you'll see this is the cost results. On the left side of the graph is the annual operational costs in US millions of dollars. On the right is the cost per dose of delivery. And you'll see the different scenarios had varying degrees of impact on the cost. The one I wanted to focus on is this bi-monthly delivery to health facilities. And it reduces the cost pretty dramatically. But when you look at it from the qualitative aspect, the logistics burden on health workers also has a positive impact on that, because if they are receiving or can fetch vaccines every 2 months, that reduces their time that they need to go fetch for that regular monthly deliveries. But the red dots are there. It has a negative impact on risk of mishandling and the feasibility of implementation. So the risk of mishandling comes from a WHO standard that vaccines at the facility level should only have 1 month's supply. And because of that standard, that influenced this feasibility of implementation and has a negative impact on the feasibility of implementation, because stakeholders were very concerned about that higher risk if there is a larger quantity of vaccines being held at the facility level. So stakeholders agreed on these two, the negative impact of that scenario on the risk and the feasibility. In Guinea, also there wasn't huge variability in the costs and the different costs of the scenarios. The one I wanted to focus on here is the integration into the central medical storage supply chain, which is of great interest. The costs are similar. If you integrate, you'll see there. From the qualitative aspect, it has little or limited impact on the logistics burden of healthcare workers because it looks at the regional level more than facility level. The risk of mishandling, there was a lot of concern that moving vaccines from vaccine-specific logisticians into general supply chain logisticians would increase the risk of just new people having to learn how to manage vaccines. However, the feasibility of implementation, there's a lot of political will. There's funder support, so there's great interest, and that can manage and mitigate the risk of mishandling. And so the feasibility of implementation got a green positive impact because even that risk of mishandling can be managed and mitigated. Niger, the cost results are here. The interesting thing I wanted to point out about Niger is in the scenario that integrates oxytocin into the vaccine cold chain. And this is already happening in an ad hoc way in Niger and other places. The cost here looks like it increases slightly. However, those costs would be weighed out from the central medical storage supply chain that is now incurring the cost of delivering oxytocin. So to the vaccine supply chain, it may increase costs, but it's balanced out from the overall health system. And there's also some positive impact on the logistics burden on health workers because health workers would have more reliable access to this product. And the risk of mishandling is negligible and can be managed. And feasibility of implementation also had limited impact because it's already happening. So it's happening in an ad hoc way. And so formalizing it would create better standards and understanding for healthcare workers. So the risk is also reduced. So another, I think, very interesting part is the cold chain utilization rate. Across these 3 countries, more than 75% of the cold chain at the facility level is using less than 10% of its storage capacity. So that essentially means facility level, there is plenty of space. There's 90% of space on average in these facilities that's empty. The analysis did show district level had more constraints and would need to be addressed with any kind of changes in any of the scenarios, but the facility level did have sufficient space, even when looking out for 5 to 10 years of population growth and new vaccine introduction. This analysis was done before COVID vaccine started being talked about, so we're not sure what that COVID vaccine would do to the facility level capacity, but there is sufficient space. And this may have implications on optimizing cold chain utilization, on optimizing cold chain design as well. So the lessons learned, I just wanted to highlight these. There are common system design scenarios that these countries explored through this modeling and analysis. And these reflect many things that have been done in other countries. So there's this best practices in supply chain design that's coming out that can help improve performance of different supply chains. The second bullet is talking about integration. And integration, again, it always comes up. People are talking about integrating, and it could be the low-hanging fruit of putting cold chain products into the vaccine supply chain, or full integration of vaccines into central medical stores supply chain. There's also a lot of concern still about taking this approach, and to me, it suggests that there needs to be more guidance on policies and advocacy to change and to set up standard operating procedures that would mitigate any risk of integrating. Another interesting point that I think came out of this is with the costing and the criteria used to compare the different scenarios. So costs are important for sure, but stakeholders also appreciated these other criteria, looking at the program and performance related indicators that really reflect the country context a bit more than just using cost indicators can do. The cold chain capacity utilization, we already talked about that, and it's an efficiency issue. And it's also potential for optimization of the cold chain equipment itself and linking in manufacturers to reflect really what the needs are at the facility level. And stakeholders, another key learning here is that stakeholders have to be engaged through the scenario prioritization and decision-making process. And with that, that has to link to resources, and whatever's prioritize whatever stakeholders identify as the key steps forward needs to have resources, needs to have support in order to do that. So thank you very much for your time and your attention. I greatly appreciate it. I hope you found this useful, and I will be available for any questions.
Thank you. And I see, Wendy, your video is already on. Thank you so much. I'm just going to quickly see if we have any questions for you in the chat. Not quite yet. So maybe I will start. And I'm sorry if I missed this, but could you speak to who you actually interviewed for the qualitative analysis and data that you had? Who were these stakeholders, and what kind of positions did they hold?
Sure. We started the whole process with a system design workshop with all key stakeholders, and those were Ministry of Health, EPI folks from national level down to subnational level. In a couple of the places, we even had facility level representatives. Representatives from the central medical stores were also involved in the process because there were a lot of questions on integration. And then the data collection was through several data sets that are available, like cold chain equipment, a master facility list, or several different master facility lists that had to be cleaned. And we did some more data collection from the facilities themselves to kind of get a reality check on what the data sets are telling us, and then the reality of the true cost and time spent in logistics.
Thank you. And now I invite anyone who is in this track to ask any questions for Wendy.
And while we're waiting on questions, one thing I wanted to bring up that's related to Carolyn's presentation earlier is the resistance to change for integration, especially with vaccines, because vaccines have been their own siloed supply chain since the beginning of vaccines, right? And now there's a lot of push for integration, and it can make sense in certain situations, but change is difficult, right? And I think this process of system design and having the evidence will then help advocate for that change when it's appropriate. And it's not necessarily the right answer for every country, and an integration doesn't necessarily need to be at every component and every level of the supply chain. It can be a phased and segmented approach where appropriate, but that change does not come easy. And it's a consistent challenge to bring in the evidence to show the benefits, how to mitigate the risks, and get people on board and make sure all the stakeholders and the leaders in the ministry at national and subnational level are behind these types of changes.
Caroline just messaged me. I'm sure she probably wanted you to see this, but she says she agrees with your point, Wendy. And I actually invite all the other presenters too, if you want to engage with the other presenters and see if you found anything that was striking or connected with your own work, that would you're more than welcome to do that. Well, yes.
Yeah, well, someone made a comment on the leadership and who's making these decisions and driving change. And it is important that people at every level are involved. And I think you kind of pointed this out, Anton, because people at every level understand the system best and understand the context. And so involving and engaging people from every different level of the system in these conversations can build a stronger system and a stronger supply chain.
We have a question here that goes, how important is continuous communication with stakeholders? As some people might think that there's over communication, so that risk too, yeah.
And that is a great question. And through this process, because it is it's data collection, but it's also advocacy for change and making sure stakeholders understand the rationale for change and the benefits and the pros and cons to both, right? And so communication is key every step of the way. And then also because stakeholders change, communicating again is important because people change and you're not going to remember things that you talked about 6 months ago because they weren't applicable then, but they're applicable now. So during any kind of system design approach, we do try to ensure that communication is clear and transparent and the right people are involved in reiterating the same messages to make sure people understand the process and can clarify any questions, because the results come back and the results can be complicated, and then you start questioning why you chose the scenarios at the first place. And so rethinking through that and making sure people understand the conversation from the beginning of this process and then the next steps on that and how to decide on next steps. So it's a great question. Communication is absolutely important.
And I'm sorry to keep bringing up COVID, but I feel like it's been such a surprise stress test for supply chain and then other things. But I'm wondering if in your and other people's experience, whether the pandemic, this crisis, has maybe pushed people more towards being open to change, seeing how a fragmented, non-integrated system can cause some issues.
And that is such a great question. And it's so timely. What I've seen is with this big push of getting the COVID vaccine out, and Gavi is supporting it, and countries are starting to plan for it. And they're building on the current systems, but it's still an emergency response to things instead of let's integrate the whole system to strengthen it as we're introducing this new vaccine, which it could be a good opportunity to leverage this new vaccine and all the attention and support, that financial support that countries are getting this to strengthen the current system. There's what I've seen countries doing is they are planning for COVID vaccine, looking at their current system, the cold chain availability, the distribution strategies depending on the characteristics of the vaccine and to what level of the system it can be kept, and then adapting what they currently have to respond to this emergency. So it's in the planning, and I think there are opportunities for more integration and more concerted efforts, because at this point, the normal routine immunization is targeting children for the most part. So it's a different population for the COVID vaccine that's inevitably going to require engaging different people and different health worker associations and different supply chain strengthening factors. So integrate. Maybe it's an opportunity for a more integrated effort and thinking broader than just the regular immunization supply chain.
Thank you. Chad, I saw you maybe unmute yourself.
I was going to say, I think echoing the same thing, I think we definitely saw that people were able to move on things that we had struggled to get traction on during normal times, removing roadblocks, removing barriers, moving faster on importation challenges. And so one of the things we are looking to do now is to solidify those things, because if you don't need them in a crisis, why do you need them normally, right? Are they actually necessary? Do those things really add value, or are they things you can strip out of your process in order to increase velocity through the supply chain? Because I think in the long run, we think that's really, really important. So I do hope that one of the, crisis becomes opportunity is the saying, right? So I hope that one of the opportunities out of these crises are that we take a hard look at some things that we do and say, maybe we don't need to do those things anymore because there are better ways to do it. But that, going back to the earlier question, requires collaboration, right? It can't be imposed. It's got to be something that you do up and down the supply chain and the stakeholders buy into. And yeah, it's got to be targeted to add value.
Yeah, and if I can just jump in again, I think Chad and Wendy have got it absolutely right. It is about collaboration, but also just learning from a crisis and doing things differently in the future.
Thank you, Caroline and Chad. Maybe we'll close out with this last question from a participant. What unforeseen challenges did you encounter while implementing the system design approach? I think this is for Wendy, but also if Caroline or Chad would also want to chime in, please do.
Yeah, through the analysis, and then maybe Caroline and Chad can speak to like implementing change, but through the analysis, the biggest challenge we saw is getting the data and accurate data and timely, and just having people respond to that. And then the consistency of messaging, back to the communications question, that stakeholders change along the way. So what some stakeholders said at the beginning of the process is different than what stakeholders believed 6 months down the road. So keeping the consistency of the processes and then reporting back and making sure people understand what the system design analysis say in order to implement any changes. And so I don't know if Caroline or Chad, you have some other thoughts on implementation of it.
Yeah, I mean, I can maybe lend a little bit of color to that. We weren't necessarily taking a system design approach, but I think in our transformation activity, one of the things that has really resonated for me is getting people past the idea of perfection as the starting point. So we definitely faced a lot of perfect is the enemy of getting started. And in many cases, there's lots of conversations around data quality, timely, complete, accurate data. And I'm a big believer that you're never going to get timely, accurate, and complete data until you start using it every single day. So we really did, in our design and strategy, run into a lot of those kind of people habits of, well, until you give me that perfect report that has everything that's correct, and it's correct going back 20 years, I'm not going to use it. And we really had to work very hard to change people's behavior to think differently around get in, use the information, and then that will actually give us the insights that we need to address some of the challenges that are there. And in many cases, some of the challenges people thought were there weren't really there once they started using the tools and the data. I don't know if that responds to the question, but I thought that might be relevant.
Yeah, and just to add to that, and slightly differently, I think one of the issues that we had was that there was a fear that by revealing data, somehow you would bring criticism upon yourself. Somehow you were laying yourself open, or the people we were working with were laying themselves open to further criticism. So there's almost a sort of silo or siege mentality. So it was a question of breaking out of that and encouraging people to understand that actually by using data, you're showing that actually you're addressing your issues. It may not be perfect, but that you're actually moving towards being more open, more transparent, and taking a grip of the issues on the challenges.
Fantastic. Well, thank you for those words of wisdom. I want to thank our presenters today and all their co-authors who may or may not be on this call. Thank you so much for sending in and having presenting your work here today. I just want to share a brief reminder. There's a 30-minute networking session right after this using AirMeet. It's the same link that you may have already used a few minutes earlier. So please join in and meet some of the people who are also in the conference and presenters and attendees. So please do that. And thank you so much for coming to Track 4. We'll see you again tomorrow. Thank you.